Hey guys, Dr. Christy Ennis. Today we are going to go over a series of stretches and strengthening exercises to get rid of this pain that's in the spine. Now, facet joint pain is, if we take out good old Bert E. Bray here, he needs to eat a little bit more, huh? But if we look at this little joint in between those vertebrae, you can get what's called spurring or some arthritis, which yes, that happens to a lot of us. And that can cause this joint space to narrow a little bit. And even you can see this lovely yellow thing hanging out of there can even cause some compression on the nerve. Now, what does it actually feel like if you've got this facet joint pain? A lot of times pain is better when you're sitting down. It's worse with standing and walking. Now that is similar to stenosis, but what is different is that usually facet joint pain is that pinpoint one little spot where that darned thing is getting pinched and compressed, okay? So that's kind of how you can tell the difference a little bit. You can still even get pain down the leg if you're getting some nerve compression. But let's start with some ways to kind of calm things down, and then we'll work on the supporting aspect of stuff. So for this very first one, I even hesitate to call it a stretch or an exercise because all you're doing is just lying there. So you need a chair or a couch or something that you can do this, which is truly just place your legs right on up. Ideally, you're going to have a 90-degree angle in the hips and the legs. I'm not quite there, but it's close. And then here's the hard part. You get to just lie there. How many times do I say that? Pretty much never. So you're going to lie here, and this is a little decompression in through the spine until it just feels a little bit better. That's it. That's the only guideline for this exercise. Easiest thing I'll ever give you to do, okay? You can do this several times a day when you're watching TV. Go ahead and read in this position. And again, all of this should feel good, okay? So from there, I'm going to, whoo, that sounded loud. I'm going to scooch back a little bit on my mat. Next one we're going to do, hands are going to come out to the side, and you can do these on the bed or on the floor, whatever is most comfortable for you. But we're just going to do a little gentle rock side to side. Now I'm starting with a small range of motion. As you go, you'll probably be able to get a little bit bigger. Now granted, that facet joint pain tends to be just on one side, so you may have more range of motion going one direction than the other direction. Totally okay. Listen to your body and go with that. So about 10 on each side, okay? And then you're going to come back to the middle, and we're actually going to do a little bit of pelvic tilting. Not one that I do a lot, but tends to work well for this specific issue. So you're going to play around with, oh, well, that hurts, okay? So then you're just going to go gentle into your range of motion that doesn't feel bad. So it's kind of like taking your hips and tilting them one way and then tucking that tailbone behind. So flattening the back and a little arch in the back. Same idea. About 10 in your range of motion that feels good for you, okay? That's important. I'm going to actually turn it on over onto my hands and knees. I'm going to bring my knees a little bit wider just because that actually does tend to feel better in that little joint space. So a little cat-cow, so you're going to lift that head, bring those shoulder blades together, tuck that chin, round those shoulders, round that spine. Again, using your best judgment on what feels good into your spine, right? That may mean you're only moving a little bit, and that is totally okay. So back and forth. I'm going to get 5 of these. Last one, I'm going to stay in this rounded position because this usually feels pretty good. And you're going to actually do a little bit of just side to side motion with those hips. Okay, so I'm just kind of rocking back and forth. And then from here, kind of keeping almost now, tuck that pelvis a little bit more and then press back into that child's pose. So a little bit different than the child's pose you're used to. So my head isn't all the way on the ground here. But usually this feels pretty good. So you can even get a little cat-cow from that child's pose, right? Kind of tuck underneath and then press back if you want a little bit more flow going. You can play around with the position of the knees too. It does usually feel better to have them a little bit wider, okay? Next, you're going to go into a stretch for the hip flexors because people forget these darn muscles and they attach to the spine. Can't see them on Bert because Bert has no muscle, but they do attach right into the spine. So I'm going to bring one foot right in front. Ideally, if you can bring it directly in front, you can even work your core a little bit here, but that actually helps to stretch all of those muscles. Toes up or down, depending on what's comfortable. Squeeze into the glutes. This is the leg that's stretching. do that little pelvic tilt again, and then come forward, right? So don't go here because now you're stretching the capsule and not the muscles. And I usually have people do a little bit of a rocking motion with this too, right? Squeeze the butt, press that pelvis forward. Do that about 10 or 15 times, and then you can hold it a little bit until you feel like, oh, I could go just a touch further. That's when you know that you're done with that, okay? So there's your stretches to really work on relieving some of that pain right away. Now we gotta strengthen things up. So I'm gonna go right onto my side. You're gonna bring your knees, or your legs, I should say, out in a nice straight line. So I'm gonna look, and I should see my toes and my feet, which is all I see. If you see more than that, your legs are too far forward, okay? So you're gonna bend those knees, keep those feet together, and just lift that top knee without rotating backwards. So just lift and back down, okay? If this is too easy, you can add a band, or this is the sneaky way to make it harder. If you think about extending, so keeping my knee bent, but bring that leg, I'm extending down from the hip, so now my knee is in front of the bottom knee, that top knee. Woo! Feel the burn here for sure. Doesn't take very many, okay? 10 to 15 would be the goal here. All right, and then from there, I'm gonna go onto my back. Arms are gonna go up. I am gonna recommend starting with your feet down to just really support that spine. And then I'm gonna go opposite arm and opposite leg. Bert's in my way a little, right? So I'm really keeping that happy spine position wherever that happens to be, right? You did your pelvic tilt, so you know what position is comfortable for you. And you want to hold that as well as gently pulling that belly button in, okay? If this is too easy, you can add a weight in your hand. If you can control and keep the belly pulled in and keep the right position, you can even bring both legs up into the air. Generally, I have people alternate, but when you're first starting, sometimes it's easier coordination-wise to just do one side at a time, all right? We're gonna flip it back over onto hands and knees again to get those little tiny muscles around the spine called your erector spinae. Woo, big fancy words for today. But these actually help to support the spine too. So again, knees a little bit wider, shoulders stacked over those wrists. Get in that pelvic position that feels good for you. Do a little shake it out. And we're gonna go opposite arm and leg without rotating in through those hips, okay? If that's too much, you start with one leg. Just kind of alternate that leg. That's even too much, you start with just the arm. And once you can keep that pelvis level, then you're gonna alternate again here too, okay? If you're not sure if you're keeping level, the way to really check this, if you don't have someone at home that can help you out, I have people take their cell phones and place it right over their back. That way, if they're tilting, their cell phone's gonna tilt. And let me tell you, if you do not want that to drop on the ground, because I know nobody wants to replace their cell phone, right? All right, one last one, and this actually is another pain one, not a strength one. I'm gonna stand on up. You are gonna grab your belt, towel, sheet, strap, resistive band, whatever you've got handy. It's gonna go around the low back. Now, most people have an issue in the lower back versus the middle and upper as far as this goes. So you're gonna place that strap or sheet around that low back. Now, usually, like I said, it's pretty low. You might have to do a little experiment and find out where it feels the most comfortable for you. So my arms are at about a right angle into my side. I'm gripping fairly tight here, so there's no slack. I'm giving a little pull, and then I'm actually giving a pull up. Now, if it hurts you to go bend forward, you're gonna do this and actually bend forward, and it should not hurt. If it does, it means you need to adjust the strap. Maybe that means it needs to go down a little bit or a little bit more pressure. If it hurts you to go backwards, same idea, right? We're just actually really supplying a little bit of gliding into that joint. That's what that is. So there you have it. Awesome ways to get that stupid little area to feel much better. So thanks for tuning in today. If you like this information, please subscribe and share with your friends and family.